The TRS ActiveCare program has been around for almost 20 years, and as we all know, it's a government-sponsored plan for Texas public school districts. Currently, there's over 90% of the Texas school districts are enrolled in the program, with a total of about 450,000 members. Once a district enrolls in TRS ActiveCare, they're prohibited from leaving, and they are prohibited from offering a commercial health plan alternative. But in the past several years, we've seen some districts petition Austin for permission to leave the program in order to gain local control over their healthcare decisions. Legislation has been introduced over the past 2 legislative sessions to allow districts to do just that, but the legislature has failed to act. Last year, a small district in Region 1, which happens to be Raymondville, determined TRS ActiveCare member districts may offer employees a choice between a competitive commercial plan and TRS ActiveCare through a District of Innovation declaration. So the question that you may have during this presentation is, does offering a TRS ActiveCare alternative health plan make sense for your district? We're all in the same boat. The natives are restless, whether we're in education or work in the private sector. Rising healthcare costs are a contributing factor to the continued erosion of the American middle class. It's become a national issue. Cost shifting to plan members in the form of higher deductibles plus other financial barriers to healthcare has not worked. We've been doing that for 35 years now. Our first response when we get a rate increase is, let's pass some of that cost on to the members. It's reached a critical point now, not only for TRS ActiveCare members, but members throughout the country that are insured through group medical plans. It's become unaffordable, especially if you have to use it. So we know that doing nothing is not an option anymore unless you believe in magic. So common sense tells us that there must be a better way to control healthcare costs. But our mindset over the years has come to believe that that's just the way it is: death, taxes, and rising health insurance costs. But that doesn't have to be. The real truth about healthcare costs really demonstrates what is the driving force of rising premiums. This slide is probably the most important slide you'll see in this entire presentation. I want to spend a little bit of time on it. This slide was put together by the Boone Group in Austin, Texas. They're a consulting actuarial firm. They've taken the cost to charge reports filed by hospitals from across the country to the government. Many of you may not know that hospitals in the United States that accept Medicare patients must file every year and attest to the accuracy of their filings, their actual cost of doing business by department. So I've selected this slide because it represents a hospital system in the Valley that our members use, some of our members use. This goes back at least 15 years. The green line that you see at the bottom is practically flat. That is the cost of doing business for that hospital by department. And as you can see, their costs have remained essentially static for over 15 years. The red line represents their charge master rates, what they actually charge patients when they come in for care. And you can see that that is running at a 45-degree angle. What's important to know is that managed care plans, PPO plans, your Blue Cross plan with TRS ActiveCare, Aetna, United Healthcare, Humana, Cigna, and all the rest, negotiate contracts with hospitals and providers throughout the country, and they tie reimbursement to a discount off the red line. So when you're tying your reimbursement to a discount off the red line, your costs run parallel to that red line. So as that red line goes up, the charge master rates go up, so do your payments under your insurance program. We call that medical trend. Medical trend over the last 10 years has averaged 9.65%, compounded every year. So you can see the effect of that red line going up at a significant steep angle. So the takeaway from this slide that I want you to remember, and it's going to create some skepticism from the audience, I'm positive of that. I've actually presented this to a live audience and I've watched the reaction, is disbelief. But here's the statement: the cost of healthcare in this country has remained essentially static for the last 15 years, but the cost of health insurance has skyrocketed. So what happens when you tie premium to the cost of care? This is an actual study I did a few years ago for a Forbes article. on some of the school groups that we manage. These are 2 school groups in the Rio Grande Valley that we've managed since 1998, and we still manage to this day. The graph only goes to 2014, but it illustrates on the blue line the actual cost of that medical program for these 2 school districts in the valley. It's remained essentially flat. If you were to extend that graph to 2020, that blue line would remain flat. The red line, of course, is inflation based on the Efferman trend analysis of 9.65% per month. So these are 2 school districts in Region 1 that have actually tied their insurance cost to the cost of care, not the cost of the charge master. If your district decides to explore an opportunity to offer a TRS alternate care and structure your plan as these 2 school districts have done, you can expect lower rates, better benefits, and stable rates over a period of time. As a side note, the 2 school districts involved on that graph previously is the La Feria and Rio Hondo school districts. If you'll look at their benefits and their cost, you will notice that their benefits are better than the Brownsville school district's cost, which is a much larger group, and their rates are about half of the Brownsville school rates. Yet the members of Rio Hondo and La Feria are going to essentially the same providers as the Brownsville Independent School District. So here's a contrast in methodologies where Brownsville, through their insurance company, is tying their cost of care to the red line, while we're charging our cost of care, our premiums, to the cost of care. What we found is deductibles drive up health insurance. We like to see those removed. And let me explain that a little bit. Hospitals' accounts receivables are running 18 to 22% a year. And that's mainly attributed to patient out of pocket. People cannot afford a $2,800 deductible, for example. Hospitals end up writing that off, but they remember that when they renegotiate their contracts with Blue Cross and all the others, where they'll load up their reimbursement levels to pick up and cover those accounts receivable. So if you're actually going into a hospital in the valley and you're not paying your deductible, the hospitals will normally, in fact, I know of one hospital executive that has told me, quite frankly, we send out a balance bill 3 months in a row. If we don't hear back, we write it off. We don't go to the credit bureau. Collecting deductibles is found money for hospitals. We also remove many of the other financial barriers that make no sense at all. And if costs don't increase, then why should insurance costs increase? The first district to challenge TRS ActiveCare, of course, was Raymondville. And they had 3 goals or 4 goals they wanted to accomplish. One, they wanted all their employees to be covered by the health plan at no cost to the employee. Number 2, they wanted to remove financial barriers to healthcare. Number 3, they wanted lower costs. And number 4, they wanted to maintain costs within budgetary constraints. And really what they wanted was local control over healthcare decisions. The challenge in doing this was, on an underwriting point of view, TRS ActiveCare, should you decide to offer an alternative program for your employees, TRS ActiveCare will not provide your claims experience. Claims experience is critical to properly underwriting any risk. So in this case, we were assisting Raymondville in a feasibility study, but we didn't have the ability to experience rate the risk. So we had to use other methods, which included the district becoming more active in quantifying the risk. And we had to find a way to pool the risk with a larger book of business. A word of warning: if you do explore TRS ActiveCare alternatives, make sure that the underwriting process is a solid, provable process. And what you may find during that process is this is not an option for your school district. So underwriting is very important to the entire process. So what are the results of the Raymondville experience? We're going into our 2nd year now. Over 100 formerly uninsured employees are now covered at no cost to the member, predominantly cafeteria workers, transportation workers, who previously could not afford the insurance are now insured. We have 90% participation in the commercial health plan. 10% in the TRS ActiveCare program. And we have a plan option that removes almost all financial barriers to healthcare. Employees or members of the plan can go to any provider they want to. However, if they choose a pre-selected primary care physician, it's up to them to do that. Then if they go to that primary care physician, they pay nothing. If that primary care physician refers them to a specialist, they pay nothing. And if the specialist recommends surgery and they're sent to the hospital, they pay nothing. So if they follow those rules under this program, the member pays zero. The second year renewal was a no rate increase. And all of this is a result of tying insurance costs to healthcare costs. Going back to that slide with the Boone Group put together on a hospital in the Rio Grande Valley in the McAllen area, by the way. We had a teacher go there in October with severe pain, went to the emergency room. They diagnosed kidney stone. They admitted her into the hospital. She was there at the hospital for 2 days, 1 hour in the OR operating room. The bill charge for the emergency room was $35,000. The bill charge for the 2-day hospital stay was $180,000. Our plan paid a total of about $12,000 for both the emergency room and the hospitalization. A typical PPO plan like Blue Cross, which typically gets a 62% discount, would have paid a total of about $68,000, or 6 times more than what we paid. TRS ActiveCare alternative programs are made possible through a District of Innovation declaration. As I mentioned before, September 1 of last year, Raymondville was the first to challenge TRS ActiveCare mandates, and they implemented a competitive commercial alternative, giving the employees a choice between TRS ActiveCare and another plan. At that time, we didn't know how TRS was going to react, but I'm happy to say that TRS has not reacted to try to stop this. In fact, since September 1, 2020, there have been many more school districts that have done the same. And here's a partial listing of school districts that have actually, beginning September of this year, are offering employees a TRS ActiveCare alternative. There's several vendors in the marketplace actively pursuing this business. First Financial is one, FBS is another, Command Health is another. There's going to be another one that I'm involved with coming out in the next couple of weeks that's going to be offering a similar type program based on the model that we've used in the Valley with Rio Hondo, La Feria, and now Raymondville. The process, if you were to decide to look at implementing a TRS ActiveCare alternate program for September of next year, is really under a tight time frame because there's some hoops you have to jump through. The first one is a feasibility study to determine risk and value. Not all districts may find this a viable option. Before you spend any more time and effort towards that regard, you probably need to have a risk analysis done of your population to determine needs and the value of offering an additional voluntary option. District of Innovation status, the district must declare a DOI status or amend their existing DOI status to include local control over healthcare. That's about a 90-day process. So the timeline really is from January through May or June, in time for July to set up the program for an effective date of September 1st. And that concludes my presentation. If you have any questions, I'll be glad to answer them.
Bill, can you go back to the process or the timeline just to hear that again, please?
Yes. This is really, in my mind's eye, not an issue of purchasing just another product or a commodity. And this is my personal opinion, I think this is deciding upon a strategy, a long-term strategy. I met with a superintendent recently, and the president of the board was at the meeting. We were discussing this process, and I said to the president of the board, School board members come and go, but the plan stays. I said, this is a plan that if you put it in place and manage it properly, should stay. It shouldn't be subject to political whims and new boards coming on board. So I think the mindset here of a district that decides to offer this has to be long-term. There has to be a commitment and an understanding that this is not just another insurance policy. We're not going to go to bid every year to change the logo on the ID card, because changing logos on ID cards don't save money. And that's just a personal opinion. I thought I'd throw it out there.
Yeah, it really does, you know, it is long-term. I know TRS ActiveCare has been doing more reaching out to, you know, what is it that the members need and the districts need and so forth, at least a little bit. You know, it's kind of, with the pandemic, that kind of slowed down, but they were doing more than I had seen in the few years that I've been involved with TRS ActiveCare as a participant and so forth. Any questions?
Well, Connie, I'd like to add to that too, because you're absolutely right. TRS ActiveCare advises against this, of course. In fact, they've put out a PowerPoint laying out all the traps that you can fall into in offering this kind of a program. And they have a lot of legitimate arguments in that regard. They are actively trying to improve the program. I think a lot of that has to do with Raymondville and El Paso breaking ship. I think that was a big wake-up call in Austin. They came out this year, of course, with their new primary care plan option with reduced rates. The unfortunate thing in my mind's eye is that they're not adopting some of these risk management strategies that have been proven to work, not only with school districts, but private industry throughout the country. State of Montana, state of California, the Medical Society of the state of Oklahoma, for example, have adopted these similar strategies that we've just gone over in this slide presentation. If TRS would simply adopt some of these strategies, there wouldn't be a need for a TRS ActiveCare alternative solution that you're seeing a demand for in the market today.
Yeah, they would be the most competitive, period. I mean, in terms of pricing and everything else, with such a huge group, even in different areas of the state, because it's huge. This is always, again, you know, for my colleagues out there, just pay attention, please, to how much of your budget gets consumed by health insurance. You know, what percentage is that of all of your salary and benefits? And it's pretty surprising. And then just the fact that folks can't afford the insurance. The majority of us that have worked with school districts found that staff have the employee coverage, especially when you're talking our auxiliary staff and our paraprofessional staff, hourly staff, period. They would have, of course, the coverage that was provided by the district. And in some cases, a small amount was still required of them. Some it's zero, but some do ask them to participate. But coverage for family or for children, or, you know, that wasn't necessarily, it wasn't affordable for them regardless. So that, but again, what's the cost? And then the self-insurance plans, the self-funded plans, you sometimes do run in the red. And again, the whole goal is just to stay above or be sure that you're running in the black. So I do know that Region 1 has signed an agreement and it's still in effect with ESC 12. I just don't think, and I do know that they've talked to 3 of the districts, but it's getting the network put together. So we still continue to talk to Bill. He works with us in terms of our product needs and so forth. So I always value the input he gives us. And what's best is if we can see it in the numbers, right? We all have experience with people who talk a good story, but I want it walked, and I want to see the numbers. I always want to see the numbers. So Bill, we will keep you posted if we hear back from any of our folks. I really appreciate you sharing the PowerPoint, the discussion, the items and everything we should be looking out for.
Well, thank you, Connie. I appreciate it very much.